So yeah, about the signs and symptoms of the COVID-19. So unfortunately, we cannot distinguish between the signs and symptoms of a regular flu because it's pretty much mostly the same symptoms. Most viral upper respiratory symptoms are pretty much the same. The most common being a low-grade fever, cough, shortness of breath, things like that. People will have like generalized fatigue, a little bit of headache. So those are the usual flu-like viral symptoms. And those symptoms may be the same one that you may be having in a COVID-19 also, but the severity can be from very mild to really severe, depending on how you're going to be affected. So unfortunately, you cannot distinguish it just from the symptoms. But at this point of time, when we have a pandemic going on, if we are not sure any mild symptoms, it may be just a common cold, but we don't know. And because we're not testing everybody at this point of time either, we just have to consider that it's possible that we may be infected and we have to take necessary precautions, which we'll be talking about in the next step. But again, as you were asking, what are the warning signs which may make us think that it could be something more serious is if you start having more sustained shortness of breath, difficulty breathing, wheezing, or symptoms of low oxygen levels in the body. So people start acting more confused. You can say from somebody being more sick than the usual flu-like symptoms. Those are the warning signs when you definitely need to think about getting them tested or getting them in to see somebody or even go to the emergency room. So, and again, we of course talk about the risk factors, people who are at higher risk. So that'll be anybody with age above 65. So senior population is definitely at higher risk. We've seen a lot of negative outcome is mostly in the senior population. So somebody who's older, you want to get them tested and treated sooner than somebody who's younger. Anybody with any heart disease history, lung disease, anybody who has a low immunity, so somebody who's on chemotherapy for cancer or any other chronic diseases like long-term prednisone, steroid use, those are the people who are high risk. Kidney disease, liver disease, again, those are the people who we want to identify and test sooner. That's that.
Got it. So if I understood it right, it seems that going to hospitals, would you advise that we take like a personal responsibility and check that how we are feeling, kind of like have that self-check within us, and if we are feeling really that bad, would you recommend at that point we go, or is it just with the very initial symptoms of shortness of breath, or I'm coughing probably for a day or so? Would that mean that I need to go to the ER?
So number one thing is, like, when you are sick, of course you stay at home. The guidelines are that we do not recommend anybody just walking into the ER. The recommendation is call your healthcare provider. So call your doctor, call your internist, because every patient is different. When you discuss your case with your internist, they will be able to tell you what is the right path to take. So that is very important. And we are even telling patients, do not go into a doctor's office, do not walk in. I work at a primary care clinic. We don't let anybody walk in. We do the screening over the phone, and we do the risk assessment and then decide whether they are safe to come in. Because let's say, we always have to think about the worst case scenario. Let's say you are infected and you are just walking in. You are putting a lot of people at risk. And that is how this is going to a pandemic scale. So we always need to make sure you're not infected before you just go in for an appointment. Going to the ER, of course, if it's a 911 level, then of course you go to the ER. But the right thing to do is, when you talk to your doctor and your doctor feels that you need to be tested, they notify the ER or wherever you're going to be tested. There are a lot of drive-through testing facilities at this point of time. So the doctors can place the order for the testing online in the EMR, and then they send the patients through the drive-through testing with the appropriate mask and everything. So they sit in the car, just take the swab and have them go home. Depending on where you live, how the setup is in the hospitals around there. Like, so I'm from Naperville, so Edward Hospital has drive-through settings set up. If it is a META system, a lot of time you're sending them to the ER, but we call the ER ahead of time and we tell them we are sending a patient for testing. So they meet the patient in the parking lot with the appropriate personal protective equipment, and then get the patient into an appropriate isolation room and get them tested. So we don't recommend people just driving into the ER. without any of those recommendations, because then they are exposing everybody in the reception area and the healthcare workers, everybody.
That's a great tip. So it seems that I think the first step, as we all need to do, is reach out to our healthcare provider from within our house or within our home, have that conversation with them, make a determination, and then kind of like go towards that next step to QER, unless it's a dire 911 call.
Exactly. And all the doctors are now doing teleconsultations and telehealth visits, so with or without video. So we are doing, because we don't want any sick person to just come in. And honestly, most of the time it is able to make a decision whether they really need to get tested or not. Because it's, again, the exposure risk too. There are so many people being tested positive around us. So we have to take a good exposure history also. Hey, do you know anybody who could have been exposed? And there are so many asymptomatic carriers. Yeah, it's very important to have to over the phone with your primary doctor.